This one PSM question sounds confusing, but if you know the concept behind it, it will be very easy. A textile mill worker complains of chest tightness that is worse on returning to work after the weekend. The diagnosis is, all this osis causes may be confusing, but not anymore. The trick is to know the disease, the causative agent, as well as the occupation it is caused in. We will only see the important ones. First, in silicosis, this is caused in stone cutters, sandblasters, and quarry workers due to exposure of silica dust. It also carries an increased risk of tuberculosis. Then in coal miners, we see anthracosis or coal workers' pneumoconiosis due to exposure to coal dust. In asbestos industry, we see asbestosis. This also carries an increased risk of bronchogenic carcinoma and mesothelioma. Then in cotton textile worker, like in our case, we see something known as Byssinosis. This name is due to Greek word derivative byssos, which means linen or cotton. This also leads to a classical syndrome known as Monday morning syndrome. Then in sugarcane workers as well as in paper mill industries, we see bagosis. This is due to because of bagaceae, which is the dry fibrous residue that we get after getting sugarcane juice. This can cause hypersensitivity pneumonitis. Then iron oxide exposure causes siderosis, tin exposure causes stanosis, talc industry talcosis, and kaolin industry causes kaolinosis. So the answer to this question is option C, byssinosis. And see this point, the chest tightness was on returning to work after the weekend. Do you know why? This is because workers with byssinosis are exposed to cotton dust throughout the work week, and during days off they are away from cotton dust, so their airways recover partially and symptoms improve. But when they return back to work on Mondays, they are suddenly exposed to cotton dust again. This triggers acute bronchoconstriction and airway inflammation. This is why this is also known as Monday morning syndrome.